Since you guys are all mic'd up, you can take questions from your seat. Dr. Miller.
Ready? My name is Brian Miller. I'm the chairman of the County Board of Health. And we're going to have each of the speakers on the dais introduce themselves, and then we're going to start.
Hello, I'm Raj Govindaya. I'm the Chief Medical Officer of Memorial Health System.
I'm Ken Sagans. I'm the Chief Medical Officer of the Springfield Clinic.
Hello, I'm Gurpreet Mandal. I'm the Chief Medical Officer of HSHS St. John's Hospital.
Good afternoon. I'm Harry Lawson. I'm the Chief Medical Officer for SIU Medicine.
I'm Gail O'Neill, the Director of the Sangamon County Department of Public Health.
Hello, I'm Vidya Sundareshan, SIU Infectious Diseases faculty member and medical consultant to Sangamon County Department of Public Health.
Well, as I mentioned 2 days ago, today is not yesterday and tomorrow's not today. And things are moving very rapidly. It's very fluid in this county. The Sangamon County Board of Health is working in coordination with these 4 organizations to establish a regular cadence of communications and fully combine everyone in this effort. We have been preparing for this situation, and it has arrived. We have 2 confirmed cases of COVID-19 here in Sangamon County. Since January, the department has been working on the situation, and the group has been expanding over time to include the full armamentarium of the community. Our department has primarily focused on protocols and lines of communication in dealing with COVID-19. We can speak toward the protocols shortly, but at this time, I'd like to introduce Dr. Raj Govindaya, who's the Chief Medical Officer for the Memorial Health Systems.
Thank you, Dr. Miller. On behalf of Memorial Health System, I first want to say I appreciate the coordination of care between the Department of Public Health, the School of Medicine, the Springfield Clinic, and HSHS. It's very important that we work together to deal with this situation around the country and here in our community. On the evening of Thursday, March 12th, a patient presented to Memorial Medical Center's emergency room. She was placed in a mask on arrival, and she was admitted. This individual has deteriorated and now is in our intensive care unit. This afternoon, we were informed by the state laboratory here in Springfield that she has tested positive for COVID-19. The patient is now in heightened isolation as part of that. Our teams are working to ensure that all of our colleagues, all of our visitors in our community are safe. This patient lives in Florida. Her son recently traveled to Switzerland. He was asymptomatic when he returned. She then traveled to Springfield on March 7th. She was asymptomatic until March 11th and then presented to Memorial Medical Center on March 12th. She visited here and was visiting family. and I believe the Sangamon County Department of Public Health has already reached out to those individuals. And with that, I'll turn it back to Dr. Miller.
Now, as I mentioned, that there are two cases. The second case will be commented on by Gail O'Neill, the director of the Department of Public Health.
Thank you. The second case is a Sangamon County resident. We just became aware of this afternoon. A few minutes ago, our nurses, upon being notified, began the notification process of the patient and the process of contact tracing, doing the interviews. This person is at their home and is participating in the process as we speak now. So kind of our job, we interview the patient, try to find out family members and where travel has occurred in the last 14 days. So that process is underway.
The next step in this process has to do with contact tracing, and Dr. Vidya Sedarishan is going to comment about what we're doing now in the community.
Contact tracing involves steps of active monitoring of persons who are exposed with or without symptoms. Essentially, symptom monitoring is a big part of contact tracing. The nurses and the staff at Sangamon County Department of Public Health is actively involved with this. As soon as there is a report of a positive test to the Sangamon County Department of Public Health, active surveillance begins. This involves an interview process of the patient. If the patient is unable to participate in the interview themselves, then it is the family and people who are closely associated with the patients. Very important for part of symptom control and part of mitigating the disease, the spread of disease, is infection prevention measures, hand washing, and quarantine, very, very important. Quarantine of the patient or suspected patients without symptoms is just as important. Infection prevention by the household members, infection prevention by healthcare prevention and healthcare workers who are involved in the care of these individuals is very, very important. So all that is being undertaken, and it has already begun as we speak.
I want to start out the rest of this by emphasizing to the public, if you feel ill, if you feel that you might have an issue, do not come to the emergency room. Do not go to your doctor's office. You need to call for further instructions. You can call our hotline number, which is 321-2606. Call your doctor's office and they will direct you to the hotline number. Do not drive in, as this will overwhelm the system and we will not be able to take care of the people who might be truly ill. Now, we need to talk about a couple of clarifications as far as quarantine. We talked the other day about restriction of activities pertaining to outside groups, inside groups, and events. First, pertaining to isolation. Isolation means separating ill people who have the disease from those who are healthy. Isolation restricts their movement to help stop the spread of the disease. Quarantine means that you restrict the movement of well persons who may have been exposed to the disease to see if they might become ill. These people may be known to have had exposure either to the person or to a designated high-risk area for COVID-19, but do not show symptoms. Quarantine can help prevent the spread of the disease. And then there's a lower level of separation we call separation or self-restriction or self-quarantine. This means that you stay home as much as possible, confining activities and carefully practicing social distancing at every moment, limiting outside activities to essential needs. Those people who have limited contact with people under quarantine fit into this category. Limited contact means being around someone who may have been under quarantine but not known to be ill for perhaps up to 10 minutes and up to 2 hours while remaining 6 feet apart. If you have distant contact with these patients for less than 10 minutes, your risk is very remote. Now, as far as meetings, initially we had made a statement that outdoor meetings would be limited to 500 people or less until a positive case become positive. Now, the outside meetings are 250. Indoor meetings or events, and I need to stress, meetings or events is less than 250. This does not include going to the grocery store, going shopping for essential needs and that nature. So going to the store or shopping is not an, quote, event because you're not maintaining close contact with any given person for any extended length of time. We have further protocols that have been placed on the website with links to the CDC recommendations subsequent to that. But again, I stress, do not come to the ER, do not go to your doctor's office because that would overwhelm the system. You need to call first for further instructions. With that, I believe our panel is available for questions you may have.
Well, the governor today said that people are lining up to, get into bars and St. Patrick's Day weekend, and that people really just don't get it. To what extent is that the problem around here?
Well, it's unfortunate that they don't get it because they need to get it. This is a significant issue. I don't believe that we're having an issue here. We have questions and concerns. We have a significant cooperation from the community, private business owners, churches, and everyone seems to be really understanding the situation here. If there's a question or a comment, we field them and we try to explain it, but that's what it is.
Can you speak to what your contact tracing has shown so far in terms of the number of people these patients may have been in contact with?
Can you hear me from here? Oh, no. Oh, I got it. Okay. The right now is early in the stage, so I'm not sure how many contacts are involved with the patient that's in the hospital. We know that she has a son in Florida, and he is hospitalized, so we know where he is. The other family members are being contacted, so we don't know how big the circle of relation is at this point. We check to see how many people live in the household, how many people spend close time together, so we'll follow that. So with both cases, we're in the early gathering of information stage, and we'll have a better idea later.
How did she travel here from Florida?
I do not know.
I can speak to that. She traveled via airplane, and she was in contact with her son for about 36 hours, and he did test positive on Friday the 13th. So I apologize if I did not state that previously.
Do you know if that plane came into Springfield? Was that a direct flight in Springfield?
I have no idea of her travel beyond that.
You know the ages of the mother and the son?
The mother is 71. I have no knowledge of the son.
And the person that's in the house, is it a house in Springfield, Gail? And what's the status of that person? What age is that person and gender?
As I was leaving to come here, our nurses had just had contact with the person, so I'm not sure at this point.
Do we know if it's a man or a woman?
This was very new. We've only just been notified about this within minutes of arriving here. So they're in the process of tracking it down, getting the information, and subsequent to that, getting further details of their living quarters, their contacts, and the such. But as far as specific details, we don't have a tremendous amount of them on this one case, as it's very new. I want to also state that for the public, the people that are under quarantine, and people, that there's a system that's being set up to assist these people in obtaining essentials, food, water, supplies, that is being coordinated with the emergency management system. And that's all those details are being worked out. But individuals under self-restriction, they can walk outside their house on their own property. They should not come within 6 feet of their neighbors or other members of the public. But this is it's on the protocols that we have set up on the website for what people can do.
Do you have a limited number of tests available in the state? Can we assume you're holding only for the sick people, or how's it going to go? Do you want to reserve for sick people only?
The testing that needs to be done and needs to be coordinated with the IDPH. Coming in, driving into your doctor's office, driving into the emergency room will not get you a test. You'll just be turned away, and by coming in, you'll impede the delivery of care. They need to call. Call first. There's a series of screening questions. Subsequent to that, the person will be directed as to what needs to be done.
So one of the criteria to have a lab test, if we're only testing those who've been confirmed by the lab, how do we know those symptoms? If we're only tested, how do we know that?
Well, unfortunately, I didn't hear your question very well.
So one of the criteria to get tested is to have close contact with the lab confirmed case. But if we're not testing people with symptoms, how do we know who has and who does not? So not everybody's allowed to get tested.
So I can answer
Vidya's
that.
going to take that one.
At this point, the testing in the community is limited. It's quite possible. What you say is quite possible. But really, the tests are being limited to people who need them rather than people who want them at this point. It's restricted to people who have had known contact with somebody with COVID-19 infection, somebody who has had travel history to one of those level 3 countries that are specified by the Center for Disease Control. So anybody that calls and gives a history of symptoms, whoever's taking the call, whether it be their primary care provider or the ER or a clinic, they go through the algorithm, and if they qualify, they are given a test. In addition to that, if anybody has had contact, like I said, with a known case, and also high-risk patients, which includes people with immunocompromising conditions, age greater than 60, with heart and lung conditions, the tests are pretty much prioritized at this point for such patients.
Have the healthcare professionals who tend to these patients been tested, or will they be tested?
That is part of the contact tracing, so they will be tested.
You have two people on two different sides. You have people who are going to the grocery store buying all of our toilet paper. We've seen it. Then you have people who don't believe this. What would you tell those people who are on two extremes at this point?
Just believe us. We're up here to take care of them. We have no other interest other than making them well. We're here for the good of the public and nothing else. There's nothing in it for us except their well-being. So believe us when we tell you something.
Florida, you said that her son is also positive, and where is he? He's here? Or?
My understanding is he is in Orlando, Florida.
On the testing, how long after exposure would it actually show up in a test? And would someone be capable of transmitting it? How quickly after exposure could they transmit it?
So the incubation period is anywhere from 3 to 14 days, and we know that people are capable of transmitting the infection even during the incubation period. The test turnaround time really depends on the lab that you're sending it out to. Commercial labs have a quicker turnaround time. I believe our labs at IDPH, which we are sending our tests to currently, the turnaround time is about 48 hours as of now.
How many lab kits are available?
I'm not aware of the number exactly, but they're limited. They're limited. I don't have a number. I'm not aware of that.
As tests become more widely available, are you expecting a drastic uptick in COVID-19 cases here? And could you possibly put a number or an estimation on that based on population size here?
That's difficult to tell, but epidemiologically, that is very important to know how exactly the disease is being transmitted, and that also dictates our mitigation plans. And like it has been mentioned multiple times, the state of Illinois has actually done a fantastic job in terms of laying protocols for social distancing and protocols for social gatherings. I think they're really ahead of the game here. And it all helps to mitigate the spread of the virus.
Gail, there were 4 earlier negative tests. We have these 2 positive tests. Have there been other tests conducted that are still pending or have come back negative?
I believe we still have 2 tests pending, as I know. And one of the things, now that private labs are able to do testing and doctors can send them out, we don't know how many of those are out there at this point. If they do come back with a positive result, they'll certainly notify us so we can do the same thing regardless of where the lab provided it.
How long does it take to be a person who was in contact with one of these individuals to be notified of your proximity to somebody who's had a positive test?
That partially is through our contact tracing. As soon as we know and prioritize the contacts, those closer, and these circles, as you see, kind of grow out and out and out. They could be way on the perimeter, but our job is to try to contact everyone. And with the availability of communication, we feel like that we get to all the levels that we can and the word gets to them. But the highest risk people are the ones we talk to first.
Immediately, 4 hours a day?
Sometimes it's whether we can get them to communicate with us, and we hope the public always, when public health calls, will communicate with us. Our intent is not to get in people's business or bother them, but to help control disease spread. So we make the calls, people are going about their life, and we may need to leave them a message and have them call us back, and some of it's immediate.
To the medical
describe the isolation situation in the hospital? Is that a wing or a room? And should people be scared to come to visit the hospital?
I'll speak to that from Memorial Health System. We've recently implemented more stringent visitor restrictions. That's a fluid situation. Those restrictions could change and be tightened at any time. In terms of our capacity, we've taken an audit of all of the negative pressure rooms throughout our health system, and we've also created a dedicated wing that was completed this morning to house COVID-19 patients. That is a dedicated negative pressure wing here at Memorial Medical Center. At Decatur Memorial Hospital, the similar plans are in progress.
So there's one wing, and right now there's one patient in that wing?
Incorrect. We have rooms throughout the hospital. In addition to deal with this, we have built repurposed current rooms to create additional negative pressure rooms in a specific wing of the hospital. So we built additional capacity to deal with this.
That's not the ICU, though.
That is not the ICU.
Who is in the ICU, and then how do you separate her from other ICU patients?
She's in a negative pressure room in the ICU.
Yeah, and at St. John's, we've set up similar process of having a dedicated unit to house some of these patients and have similar protocols in place.
Can you each speak to your resources on hand as far as masks, gowns, things like that? Are you concerned about having adequate supply? And also staffing, given the additional pressures this could put on staff if we have a significant increase in cases?
So yes, we have taken inventory of all our personal protective equipment. We have plans in place to optimize usage and decrease wastage. Of course, we are working with our supply chain folks to make sure there's adequate procurement of this, so we can protect our patients and our caregivers, but avoid wastage therein. And those plans evolve and change over time. They're dynamic. They escalate based on the amount of inventory you have and all cases you will be seeing who would be needing such protective equipment. So,
the only thing
the
only thing I would add to that is our purchasing groups have actually reached out with the Springfield Clinic, the School of Medicine, Memorial, and HSHS to buy these things together if that can speed the delivery of these products. But we're doing all the same things that Dr. Mender mentioned.
Are people overreacting by going and completely clearing out shelves in stores? Is there a certain way that you guys can let them know not to overreact what we should be buying and doing?
Well, I believe that the actions that you're seeing with the in the stores, it's a reaction to the unknown. When people are afraid, they'll do things that may not be logical. So, is it? Most likely. But they think they're doing the best for themselves and their family, so it's logical to them. What we're trying to do is maintain a very open amount of open communication. We want people to know, because once you know, people tend to make very rational decisions. When you don't know, that's when you make irrational decisions.
For the hospitals that there's been third-party testing done in Missouri now, I think in Pennsylvania as well, what's the timeline for getting third-party testing in Springfield?
I can't hear it.
So we have contracted with one lab to do third-party testing. There's a little myth about this. These third-party labs, they're requiring the same criteria as the Centers for Disease Control. So the same criteria that the Illinois Department of Public Health is applying, so are most of these labs.
And so, but does that increase the number of tests available in the same county?
It increases the number of labs doing the test. It does not make it easier for you to get a test.
Teal, how many calls have come into the hotline since you started?
About 400. Yesterday there was 137, I believe, where we actually took calls and answered questions.
Can you speak to how many people are complaining of symptoms of this?
Symptoms would be a minimal amount compared to just the concern, the fear factor. Maybe a quarter of them, but we're in flu season, so it's flu season 2, head and cold season. The ones that truly had symptoms and talked to the nurse and they go through the same algorithm may have been contacted, told to go to the ER, but we don't send anybody to the ED or anything out with calling the ED first, and so they're well aware that we have a patient coming through. So I don't know if any of those even happened yesterday.
The state estimates that about a third of the cases they see involve potentially community spread, and since we now know it's in the community, will these restrictions be loosened at any point, do you think, or on testing?
On testing, not until vaccine, but not until the tests are more widely available. But it will restrict. Do you want to answer that?
I can answer that. At this point, like I mentioned earlier, we're just still going through the algorithm and restricting the test to people who are high risk. But at a later point, when the test becomes more readily available, there may be changes in guidelines as per Center for Disease Control and IDPH.
And you or any of the doctors, are you frustrated that you're not able to get the test to more people who have flu-like symptoms?
Well, you would like to. Go ahead.
Sorry, I was just going to say, when requests are made for a test that we really think is necessary, we have not been denied. When people have symptoms that fit the criteria, the IDPH allows us to do the test. We would like to be able to do more testing for other reasons, but right now, things are adequate.
I'd just like to add, a lot of experts believe if you don't test enough, you won't know the disease is existing. So from that standpoint, from an epidemiological standpoint, yes, it is very important. But these algorithms are pretty good, and I think anyone who needs the test is able to get the test going through the algorithm.
And are you saying what company that is or what the third party test?
I'm not aware of what company that is. There's multiple companies, though, that we've reached out to, and I'm sure all of our sister organizations on the stage have done so as well.
Correct.
If there are people that have been asking for the test, they're at home right now because they're waiting to see if that's going to be possible. They may have relatives that are in the same house with them. Obviously, it could be all ages, and we've seen the impact of children all the way up to the 90s. So what do you suggest for families that are dealing with that right now? If they're getting, the same statement, we can't give you the test, you're not at that perfect amount that's required to be tested.
Well, you want to answer that question?
Yeah, I would. The advice that we're giving from the hotline and from our nurses is if you don't know and people are concerned, we ask them to take their temperature. If they want to do something proactively to kind of keep track of this, if they would take their temperature twice a day and log that and be aware of how they feel. We certainly don't want anybody that's truly, gets sicker than just the common cold or the flu. We want them to seek medical care and call their doctor, but to do something for themselves, if they start taking their temperature and do it regularly for the 14 days, that is something that would be helpful for the doctor to know if they do indeed get sick during this time.
And Gail, just to clarify, on the second patient that is at home, you don't have any indication as to how they may have contracted it?
Not yet.
And you don't know if it's a man or a woman at this point?
I don't at this point.
And this might have been said earlier, but should people go out to celebrate anything tonight? Should they be at restaurants and bars, or should they not? Or what would you do with this out?
I would tell people to be really careful where they spend their time right now. I mean, we're in a place where it's personal decisions where they want to go, and 6 feet is quite a ways. You don't want to spend too much time in close quarters with people that you don't know. It's the same as the flu and everything else. Yes.
You guys aren't 6 feet apart, are you?
No, but we've got a lot of air around us, and we've been cautious. And we've talked about that with meetings. If our meetings grow, we're going to do them by phone.
Earlier today, we heard the governor say there were 64 cases in the state. The addition of these 2 cases, is that number more prolific than anybody thinks?
Well, the rate of infection, the rate of exposure is going up because here in this county it used to be 0. So 1 is way more than 0. So the rate of infection will most likely continue to increase, or not the rate, but the number of cases will continue to increase until there is more of a handle on tracking down contacts. People that do become ill will eventually become better, most all of them. There are some that won't. So the number of people getting sick and be exposed is going to go up. What we're trying to do is slow it down. Because if we can slow it down, the system would be more readily able to handle the situation. If everyone gets sick all at once, it'll overwhelm the system. And that's why we want to limit exposure, delay exposure. And one of the ways that we do this is by social distancing. Don't be running into the hospital. If you think you might have something or running into your doctor's office, you need to call first so that we can do this in a very logical, stepwise fashion.
Dr. Miller, excuse me, may I just make a comment on the social distancing as well? We have one inpatient. We also tested someone in an outpatient facility, and we had to practice social distancing as well. So when we tested that person, our staff, garbed and gowned in the correct personal protective equipment, in the healthcare industry we call that PPE, and we went outside and tested that patient outside to practice social distancing. One of the goals of testing is to prevent people coming into your facilities. And so when we tested this person, we did that. And that's the sort of thing that everyone needs to think about. How do you keep yourself safe? And social distancing is a great way to do that. That's why we tested a patient outside, and that's the patient who's now not in the hospital, that's in the outpatient environment.
Now, what are the hospitals doing to prepare for a worst case scenario? Obviously, we've seen systems, say in Italy, overwhelmed.
assuming that it does spread here at Springfield and it's widespread, what are the hospitals doing to prepare for that scenario?
Yeah, so we've, at St. John's, we've activated an emergency management preparedness response. We have teams which have been meeting for a little while to plan for this. We have contingency plans for, obviously, for patient placement, for flexing up as far as staffing is concerned, or patient needs come up, also conservation of personal protective equipment. And also, as you go through different stages and the cases increase, there are different contingency plans which get put into place to increase capacity therein. So.
Are we identifying where that other test was done? Did you say that? Or
I don't know what memorial facility, but it was done out. It was done outside. It was one of our outpatient facilities. Yeah.
And for the patient in ICU, is this treated just like any other pneumonia or any other flu complication? Are those treatments effective for someone suffering from COVID-19?
So there are no antibiotics, there are no antivirals, there are no vaccines. It's supportive care right now. We need time to develop those things. That's why we're asking people to socially distance themselves. That's why we're asking you to stay away from other people. You may feel fine, but you can infect other people. That is how this individual got infected. Her son felt fine. They spent 2 hours in a car together. She got sick.
And I'm sorry, to clarify my question though, if someone had just standard flu and developed complications, would it be treated differently than what you were treating for prevention?
There are antiviral medications for the flu. We do not have antiviral medications for this.
So the test that you did at Memorial, that counts in the 8 that we were talking about there? Are you communicating the number of tests that you guys are doing with the Department of Health? Is that number being updated?
Yeah, I'll defer to the Department of Public Health on the total number of tests. They were aware of all the tests that were done at Memorial.
Yeah, at this time, we're aware of all the tests. It'll change a little bit when people use private. Well, they don't have to go through us. I'm sorry. They don't have to go through the department for verification and approval with a number to send it through the state lab. The tests, however, Biddy had said that the private labs were using the same criteria, but we would not know as much if they don't go in the state lab.
Is that concerning in terms of trying to control the spread if you don't know?
Actually, the hospitals, we're all working together so closely on this, and we're meeting at least daily, if not several times a day. So we've got a good communication system set up, so I believe we're going to know what's going on in our community.
For staff not involved with inpatient care, what social distancing policies are in place for your staffs?
In outpatient.
From outpatient standpoint, yeah. So we're doing
For not inpatient.
for outpatient, yeah. We're doing a similar situation. We take the same precautions. We have questions and screening protocols for patients ever come in. Once they get in, we continue to practice the same restrictions or plans that the CDC recommends and what you've heard up here tonight. So,
Same for SIU, following our infection protocols that we've had in place for some time.
Is this viewed as more contagious than standard flu or other viral illnesses?
Yes.
Easily transmitted?
Yes. Yes, they measure it by a number called R-naught, which is how much exactly gets transmitted for people that are exposed, and the attack rate, they're all much higher.
Are the numbers from Sangamon County say not including the governor's numbers today? Neither of those cases was included in this?
I don't
They're
believe
not.
so.
They're not. And are there any
Not yet. They probably are now.
Are there any new instructions for either workplaces or churches that you want to say, is it just down to, I mean, you say 250 outdoors, any change to indoors, is that still 250? I'm sorry.
For a meeting or an event. That's correct. Those are CDC protocol.
Obviously, we're in the state's capital here. Lawmakers are set to come back. They have a week. But do you think they should come back, or should it be pushed further away now that we have cases here in the capital?
Well, again, what they need to do is follow the protocols that are written. They have their separate offices. They can't fit 250 people in an office or in the rotundum, or, well, in the rotundum you can, but in the house where they have the sessions, but they may certainly need to limit who comes in and who comes out and the number of people that come in, because you could easily exceed that number thereafter. So that is what I would say. Certainly if they're sick, such as we see some of the lawmakers on the Hill, they're isolating themselves and trying to avoid infecting others if they're infectious, or avoiding infection if they're not. So.
To build on Mike's question, though, the lawmakers aren't back until the 24th. I mean, this is changing by the day, by the half day. Who knows what the situation will be like on the 24th?
Right, and I'm absolutely, things change every single day. The governor seems to have a very good handle on this, and I'm sure he will make the decisions for calling into session or suggesting whether they call into session or not, dependent upon the situation. It's fluid, but we'll get through this. We just need some time.
Is there a plan for regular briefings locally, such as the state's doing, or just events more?
We're having another group meeting tomorrow morning at 8, so that we will discuss that. And it would be easier on you guys and us too to have a regular time to give you some updates. So we're going to discuss that tomorrow, and we'll get that information out to you.
And I'm the 71-year-old lady, and the people she was visiting in Springfield, have they been tested, or do they have to be symptomatic to be tested, or do you have can you give a situation at all? Is that in a home, like somebody's house?
So by the testing criteria, they do fit the criteria as exposure to somebody with a confirmed COVID-19. So they will be tested, people who are in close contact with the patient.
That's her family as far as
Her family.
Does that test have to wait for a period of time after their exposure to her?
No, not necessarily.
So as long as you know you've been in contact with somebody, we will test you right away. But if you're feeling symptoms, you may or may not be tested.
If there is no exposure and somebody has symptoms of upper respiratory tract infection, then they don't really fit the criteria.
How do they know if they've been exposed? They don't know the person, like, have been out and about or anything like that.
That's where the contact tracing helps.
And the 2 hours in the car, that was in Florida?
That was in Florida.
Thank you.
I would like to have one other statement be made. Andy Van Meter would like to. We're done? Okay.